This is All India Radio. In the program Spotlight now we bring you a discussion on review meetings by Prime Minister and Home Minister on COVID-19 situation. The participants are Ashok Tandon, political analyst, and AIR correspondent Renu Kataria.
Landmark decisions were taken today in the meeting by Home Minister Amit Shah while reviewing the national capital's response to coronavirus amid rising concerns over the rapid growth of the virus. What major decisions were discussed and what are the steps to implement them?
Today's meeting taken by the Home Minister with the Delhi Chief Minister, Delhi LG, Health Minister Dr. Harshvardhan, and also the presence of the AIMS Director Dr. Guleria. All that was a follow-up of the meeting Prime Minister held yesterday. So in this follow-up meeting, it was a very crucial meeting, particularly to discuss the COVID-19 situation in Delhi, the national capital. Because in the last couple of days, the number of cases in Delhi has been rising, and there has been a situation where the impression which has been going out was there is lack of coordination between the Delhi government and the municipal corporations of Delhi and the central government. Because there is multiplicity of authority in Delhi, so I think it was advised that let the Home Minister convene a very crucial meeting, and that is exactly what happened today. Because the meeting which will also, again, the Home Minister will be holding another meeting again with the 3 MCDs of Delhi. So today, at this high-level meeting, as you very rightly said, which was held in the backdrop of the Delhi cases rising beyond 2,000 per day and 57 deaths in the last 24 hours. So one of the crucial decisions was that committee has been set up under the chairmanship of Dr. Ball of the Niti Aayog, and this committee will give its report tomorrow, and the committee has been asked to examine whether 60% beds in the private hospitals of Delhi can be reserved for the COVID-19 patient at a cheaper rate, because the normal charges in private hospitals are quite high. So this committee will examine and give its report, and not only the beds will be available at reasonable rate in the private hospitals, but also the testing facility. So this was a very major decision, because the Delhi government has been actually complaining a lack of the beds available in the government hospitals. So therefore to rope in private hospitals, but a reasonable rate. So that one of the major decisions. And another decision taken was that the railways has been roped in, provide facilities for the Delhi patients. The railway should make available its coaches which have been specially prepared as COVID-19 isolation wards and also for treatment wards. So it is decided that about 8,000 beds may also be rated through that. And another development which took place was that the Radha Swami Satsang in Chhatarpur, in fact the Lieutenant Governor Mr. Anil Baijal soon after that meeting went and examined that place where 10,000 beds are likely to be created with the help of course, Radha Swami Satsang. So these are some of the crucial decisions which will come as a respite for the people of Delhi and also the authorities in Delhi. Mayors will also be meeting the Home Minister, and hopefully that the panic which is being created in Delhi due to lack of facilities and lack of beds, etc., will be set at rest, and I think is a matter of relief for people living in the capital.
So there was another decision that was taken. 5 senior central government officials will be assisting the Delhi government. What advice will these officials provide to the government on aspects of COVID-19 management?
First of all, the presence of the AIMS Director, Dr. Randeep Guleria, was very significant because AIMS is the nodal center for coordinating the COVID-19 pandemic all over the country. So Delhi being the capital, Delhi AIMS being the nodal place, so obviously the all sorts of assistance which is required to Delhi and the people of Delhi and the Delhi government, so the medical aspect of it will be taken care by the AIMS doctors and their experts. But at the same time, because Delhi is a union territory, So it falls under the central government, although there is a separate Delhi government, but overall responsibility of Delhi also lies with the central government. That's why senior officials of Delhi now will be at the disposal of the Delhi government and also of the Lieutenant Governor of Delhi to coordinate things so that there are no loose ends. And tomorrow there is no complaint due to lack of coordination and proper management. The cases in Delhi were getting out of control. It appears that the central government headed by the Prime Minister Narendra Modi has taken a serious note of the situation particularly in Delhi. I think that is one of the reasons why this crucial meeting was held today.
So can you also elaborate the Prime Minister's meeting with the Health Ministry officials yesterday to undertake emergency planning for COVID-19 in consultation with states and union territories?
Yes, because since the lockdown was lifted partially and there were a lot of movements taking place, industry, trade, commerce, railway, airlines, and in that context, and it was expected, when lockdown is opened up, there may be more cases coming in, and that was perhaps happening in different states. Particularly, the major concerns was coming from Maharashtra and also some of the main cities. And that is why the Prime Minister took the initiative and held a review meeting yesterday, and the Prime Minister was given a presentation in which the projections of the next 2 months were presented before the Prime Minister, and in the light of those projections, the steps needs to be taken at all India level and what exactly could be done, and that was the purpose of the meeting, because the Prime Minister is scheduled to meet the Chief Ministers on June 16th and June 17th. So unlike last time, where now the meeting could be split. Some chief ministers he will meet on the 16th, another batch on the 17th. And therefore it was necessary that the Prime Minister knows about the situation, the gravity of the situation and the preparedness of the pandemic, particularly onset of the monsoon season. There was Dr. Vinod Paul also, member Niti Aayog and convener of the Empowered Group for a Medical Emergency Management Plan. All these experts briefed the Prime Minister that 2/3 of the total number of confirmed cases of infection have been reported from 5 states, with an overwhelming proportion of cases in big cities like Mumbai, Delhi, Pune, Chennai, Ahmedabad. And that was the focal point of the entire review meeting. And therefore, measures that were discussed to augment testing also was specifically in the context of these big cities and 5 states. And the Prime Minister's meeting with the Chief Ministers, 17 June would be the turn of the Delhi Chief Ministers. So therefore, the Prime Minister also apparently advised the Home Minister to hold a separate meeting with the Delhi people, which he held today. So Prime Minister actually was very much concerned that we must ensure the district-wise requirements of hospital and isolation beds. Prime Minister Modi also advised the Health Minister Dr. Harshvardhan to hold preliminary meetings with the state health ministers and also the officials in those states, so that minimum time is taken during the discussion with the Prime Minister at the Chief Minister's level meeting. The Prime Minister has been taking all the necessary initiatives, not only in India, but even among community of nations at all levels, whether it is G20, G8, whether it is ASEAN, whether it is SAARC countries. So there is no reason why he should not be leading the nation from the front in dealing with this pandemic, especially after the lockdown has been lifted. Industry is coming back to normal. Trade and commerce also is coming back to normal. In fact, the life gradually is now coming back to normal.
So today's meeting, Home Minister Amit Shah said COVID-19 test in Delhi will be doubled in the next 2 days and increased by 3 times after 6 days. Is the city's health infrastructure prepared to start this testing, and what immediate plans do they have for contact mapping, especially in the 219 containment zones?
All these effective steps have been decided. When the Home Minister says that the testing will be doubled, in the coming days it will be increased further, there is no reason that why it should not happen. And in that context, the availability of senior officers at the disposal of the Lieutenant Governor and Delhi government is an indication that all the necessary help will be coming from the center, and there is no reason for people of Delhi to panic. Dr. Paul, who is heading this emergency group now, is heading, in fact we are submitting a report specially to rope in the private hospitals in Delhi, and if testing starts and the beds are available in private hospitals at a reasonable rate, testing also is done at a reasonable rate. So once testing is taken at a mass level, contact tracing also has been very major initiative, but somehow it was felt, and through the media reports also one can judge that somewhere something was lacking in Delhi, and Home Minister has now taken up all the, and things should be coming back to situation where things are under control, so there should not be any panic situation.
Sir, another decision was the screening and detailed contact mapping in containment zones. The comprehensive door-to-door surveys regarding testing is also a big step towards containing the spread of the virus. Can you elaborate more on this?
See, recently in Mumbai, Dharavi, the biggest slum in Asia, man-to-man contact mapping and testing has been done at a very vigorous level, and results are visible. So if that can happen in Dharavi in Mumbai, why can't it happen in the resettlement colonies of Delhi? Because most of these containment zones in the national capital are either in the resettlement colonies or Jhuggi Jhompdi colonies or the clusters which are there in the Delhi villages. And most of these new cases are also coming from these containment areas. Now onwards, vigorous testing, contact mapping, and also door-to-door testing, man-to-man testing will happen in Delhi. And that is how the authorities will be able to control this pandemic, contain it, and give some sigh of relief to the people of Delhi.
The recovery rate of COVID-19 crossed more than 50% in the country, but simultaneously we are also seeing a rise in the cases of coronavirus. What measures have been taken to reach this recovery rate?
In whole of India, the recovery rate is around 50%, which is phenomenal. Nowhere in the world the recovery rate has touched 50%. Another very heartening feature is that the mortality rate in India is also perhaps the minimum as compared with the other countries. And that is the story everywhere. If we leave these 5 states, in the rest of the country, the recovery rate is much beyond that. But these 5 states which are counting for most of the cases, even there also recovery rate is around 50%. And the mortality rate in India is also perhaps minimum in the whole of the world. But nevertheless, since the rise in cases is a matter of concern, so authorities cannot lower their guard. They have to take all precautions, gear up for the situation, especially because monsoon has set in now. Heavy rains can also disrupt the arrangements. So in that context, I think the Prime Minister will be talking to the Chief Minister to make special arrangements so that we can contain this pandemic, and situation is under control. But rise in cases, especially in places like Delhi, Mumbai, Chennai, Ahmedabad, is a matter of concern. The municipalities in these big towns also have a major responsibility. So they need support from the center and the state government, but the municipalities are at the micro level. So if they are geared up properly, there is no reason why all these effective steps cannot be taken. So we do hope that in the coming days, the local authorities, the municipalities, all big cities and other medium level cities will come up to the expectations of the people with the support of the state government and all necessary aid and assistance from the central government. That seems to be the idea. We will see in the coming days, when the Prime Minister will hold meetings with the Chief Ministers of different states. Things should be coming back to a situation which will be described as under control.
Thank you, sir.
Thank you.
You were listening to a discussion on review meetings by Prime Minister and Home Minister on COVID-19 situation. The participants were Ashok Tandon, political analyst, and AIR correspondent Renu Kataria. This program was produced and presented by the News Services Division of All India Radio. You can listen to it on our mobile app News on AIR. This program is also available on our website newsonair.com. You may email your opinion about this program at airnsdtalks@gmail.com.